Hi, I'm Dr. Kate Barteau. I work with clinical radiologists and we interpret the mammograms and do breast imaging here at the Blessing Breast Center. There are two benefits that we've discovered so far. One is that we are finding some of these small cancers that used to be obscured on the 2D images. And an additional benefit to our patients is that sometimes on the 2D mammography we see something that looks like it could be a small cancer, but when we bring the patient back for additional imaging, which we call a diagnostic mammogram, we find out that this was just normal breast tissue that was superimposed upon each other to make it look like a mass. And so we're discovering that with the 3D mammography, by having these additional images, we can look through and see that this is just tissue overlapping each other rather than a true mass. And that saves that patient from having to come back for the additional imaging. That additional imaging and the callback is extra cost and anxiety for our patients, and we can benefit our patients by decreasing that. This is a patient's breast that has had a 3D mammography. And so basically we take the images and it's reconstructed into 1 millimeter thick slices throughout the whole breast. And so that dense tissue that could obscure a mass is now not going to be obscuring so many things. So we can see right here there's actually a little mass, right? This is what we would consider a mass with these little spiculas coming out of it, which very easily could be obscured on a mammogram with 2D technique. And I can actually switch that to show you what it would have looked like on the 2D. So by switching back, this is the 2D image. So it's really hard to see if this is the area of abnormality, it's very hard to tell if that's anything different than this tissue or this tissue. But because we can take away the overlapping tissue, things kind of jump out at us now that were hidden before. This is that mass. If you have a 3D mammogram and we can only see the cancer with the 3D mammogram, if you do the 2D we don't see it, we do other modalities to try to find it such as ultrasound, but it's occasionally the only way this is showing up is on the mammogram, the 3D mammogram. So the only way we can biopsy this is to recreate that. And so our machine, the 3D mammogram machine, does offer that ability to recreate that scenario so we can find that tissue and biopsy it. The other alternative in those patients would have been just to put a wire in. The patient would have to go to surgery and have that surgically removed, and that involves anesthesia, putting someone to sleep, and leaving a scar and a defect in a woman's breast. So we can get rid of all of those. So I also encourage any women that have this procedure, the 3D mammography, at another institution that doesn't offer the 3D biopsy option, that we can do that here for the patients.